Welcome back at 7:14. For many patients recovering from an injury, surgery, or chronic medical condition, rehabilitation therapy can help. There's a big difference, though, between inpatient rehab and outpatient care. Dr. Benjamin Hefner from Touro Physical Medicine and Rehabilitation joins us to explain. Dr. Hefner, good morning. Thanks for being with us.
Good morning. Thanks for having me.
So let's first talk about the types of injuries, chronic illnesses, surgeries that would require someone to be in a rehab, be it inpatient or outpatient.
So there's a wide variety of medical conditions that can need people to require inpatient rehab, and that can be anything from a stroke, traumatic brain injury, spinal cord injury, to anything more broadly like a critical illness, a major traumatic incident, cancers, anything that really reduces a person's functional capacity to do what they need to do at home and just feel like they're not ready to return home yet.
So let's talk about the two different options that people would have on their journey to recovery. Who, I should say, would be eligible for an outpatient rehab option?
Sure, yeah, so the difference between inpatient and outpatient is inpatient people are really close to their injury. They're probably still in the hospital and they're thinking about, how do I get home? What are my next steps? Where do I go from here? And so those are the folks that feel like they're not ready to return home, and that's where inpatient rehab comes in. And at Touro, we're really focused on quality of life and helping people do the simple little things that everyone needs to do every day to return home. Bathing, dressing, feeding yourself, moving around. Talking, all those things that can be difficult after a critical illness. And then typically we transition to outpatient after that, where people have made that transition home. So they're doing better medically, physically, and they can go to the outpatient clinic several times a week. And so it's a kind of a continuum of care where we go from more intensive to a little bit less intensive, but all the while working on quality of life and improvement for our patients.
I know people at home are thinking, I have a relative that I'm in charge of taking care of, and they've had a serious injury, or they've had an injury and they're still recovering from it, but at home, and I'm helping them through this process. Where do family members, loved ones, the support system for these people go for guidance in, one, understanding the difference between these two spaces and deciding which one is best for their relatives or their loved one?
Absolutely, yeah. So inpatient rehab may not be something that is well known to people in the community, but is a very special and important part of helping people recover and improve from medical conditions and illnesses. So they need to talk with the patient's caregiver or their care provider. So either their physician that's taking care of them in the hospital or their primary care provider to see what next level of care is best. And so if they're still in that critical stage where they're in the hospital, talk to the doctors, say, my loved one still needs a lot of help. We need to get them home. Can we talk about rehab? And so, at Touro, we're really focused on getting people home, improving their quality of life, and doing everything we can using the most technologically state-of-the-art equipment to do so quickly.
Well, doctor, thanks so much for helping us understand that. As you mentioned, that inpatient option, not really something a lot of people are familiar with, but a resource that's there to help the person who's going through whatever they're dealing with medically and their loved ones.
Yes, absolutely.
We appreciate your time this morning.
A pleasure.